Well, hello, everybody, and thank you for attending my class today. We're going to talk about hyperpigmentation. I think it's a good thing to talk about it because, yes, the summer is coming soon, and we want to know everything about hyperpigmentation. So my class is sponsored by Nelly de Vuyst. So I think I'm going to enhance, or I would like to vulgarize all the terminology and really simplify it in simple words, everything you need to know about hyperpigmentation today. And as you know, as a sponsored Nelly de Vuyst, all our plants are certified by Organic Cosmos, EcoCert, sorry, by Cosmos Organic. And we have a GMP certified facility. You see on the board, we are one of the, as you probably are aware, Health Canada is one of the strictest regulatory body when in terms of, manufacturing certifications. Protocols. So worldwide, it's becoming really trendy to have a product made in Canada. So we're so proud to say that Nelly de Vuyst is manufactured in Canada with the strictest, compliance. And of course, we're cruelty-free as far as our products, vegan. We have a whole amount of products on vegan, GMO, no GMO, of course, and none of the chemicals, and more of a clean, sustainable product. As far as the packaging, it's all so sustainable. So we're talking about recyclable material. So let's talk about hyperpigmentation today. So we're going to talk about overall what actually aggravates. So let's first go back in a little bit of theory and see how that does the melanogenesis process takes place. So I want to use simple words, but let's look at the skin. And basically, the pigmentation takes place at the bottom of the epidermis. So that's where the melanocytes are actually located. So we find the melanocyte as the cell that actually produces the pigmentation onto the skin. So it's important that you visualize this with me so I don't go back. And it's located right here at the bottom of the epidermis, where the layers of our skin, which is the main, basically the skin being the organ that's there to protect us. And especially today, we need to have a healthy skin with a good microbiota in order to, to be protecting ourselves against any of the environment, of course, bacteria and viruses. So we want to keep our skin healthy. Even in terms of hyperpigmentation, you'll see what happens to the cells also as we're aging. So I also want to pay attention to the actual melanocyte. So the melanocyte cell looks like an octopus. So if you look at the octopus, that's the cell that you saw at the bottom of the basal germinative, at the bottom, sorry, of the epidermis, which is located at the bottom of the epidermis, called the basal germinative layer. And it's found, that cell is actually found approximately every 10 cells. And that's what actually creates what we call the melanogenesis process. And what happens is that cells, due to, of course, from sun exposure, we're going to see a little bit later, and the activation of the, basically due to our hormonal activity, this cell stimulates an enzyme that actually, stimulates the production of that melanocyte. And that melanocyte has little octopus. And I want you to pay attention to it because these octopus actually liberates all the melanin throughout the skin. And it's important to know this because as we are aging, especially at menopause, due to a lack of estrogen, what happens is that these little octopus becomes hardened and they're not liberating the pigment evenly. So it's actually affecting the skin color, and that's why we see either discoloration or areas where it's more pigmented. So this is the cell that's responsible for this. So it's important to be aware. So the melanocyte, as I mentioned earlier, we find approximately every 10 cells a melanocyte that creates the melanogenesis process, therefore colors our skin, part of our protection. So when we look at the skin and the melanogenesis process, we look at the sun exposure. We say that, it's very important to protect our skin from the sun, and especially in this presentation today, we're going to focus on the importance of using an SPF 30, having a UVA, not just UVB, but a UVA protection. So ideally using mineral. But when you use sunscreen, no matter which sunscreen you use, be aware that we are also protecting the sun rays to synthesize the vitamin D. So it's like protect your skin, but on the other hand, you may lack of vitamin D. So we need to compensate if you don't have that vitamin D because it's actually synthesized within your epidermis. So if you don't have the sun exposure, we don't have the synthesis of the vitamin D essential for our health and our immune system of the skin and immune system overall. So I thought it was important to mention. But nevertheless, there's even application, I don't know if you know about this, there's even applications depending on the country where you live, how actually you can benefit from your own vitamin C production at certain times of the day. You can look it up, it's very interesting. But nevertheless, we need to be, especially if you're genetically predisposed to hyperpigmentation, you want to extremely protect the skin, the face, so that you don't have the exposure of that, pigmentation that is in abundance and also create those spots, those dark spots that we see on our face. So basically that is really one of the main causes of our hyperpigmentation. It's really, unfortunately, we'll see a little bit further, how it's actually affecting your enzyme that actually produces your skin and the liberation of all these pigments onto the skin. So healthy skin, basically we need to be protected. We need to create pigmentation. That's part of our immunity to have pigmentation. Some people have different types of color, different types of component of it, but we need, and also the density of the pigment, of the melanin. But nevertheless, it's important, and that's a healthy, in the skin, melanocyte or melanocyte system. And then when it's abnormal, you can see that the pigmentation gets, it's like an agglomeration. So you see a lot of particle of the pigments located in one area, and that's what causes the pigmentation onto the skin. But the melanogenesis process takes place normally. This is the basal germinative layers. That's what we mentioned. That's the melanocyte cells with the octopus in a different view. And it's creating the pigmentation throughout our skin. Also, not only the epidermis, but also the dermis. And we will talk about PIF, post-inflammatory hyperpigmentation, a little bit later. And when I refer to PIF, that's a little bit more complex because we're talking about more of a dermal activity of the pigmentation. That's when the melanin is actually distributed, within the dermis tissue. So it goes beyond, when we talk about depigmentating the skin or regulating the epidermal activity when it relates to pigmentation, we're referring to the epidermis, so the upper layer of the skin, not deep down. But I'll refer to this a little bit later. So this is how it takes place. So the melanogenesis process, basically you get the sun exposure, so ultraviolet radiation comes through the place, then stimulates what we call the MSH, melanin stimulating hormone. So MSH then stimulates the tyrosinase, which is an enzyme that stimulate or create, if you like, the pigmentation process. So the tyrosinase then produce the melanosome, and the melanosome then distribute the pigment throughout the skin. And that's really how it takes place. What causes the aggravation, of course, we know that certain phototypes, so phototypes as per Fitzpatrick skin type, we know that Fitzpatrick skin type 3 and 4, that means when you have a darker skin, you have more predisposition of having hyperpigmentation or melasma in time. ROS is the reactive oxygen species. This is like the family of free radicals. So if you are extremely stressed or you have different stressors topically, it could be from topical products or just overall stress, that can also affect the melanogenesis process. Then inflammatory reaction. Let's say you have acne and you're genetically predisposed to hyperpigmentation and you start picking your skin. Well, if you pick your skin because of this compression, you may have or may cause a post-inflammatory hyperpigmentation. So you may cause pigmentation because of the inflammation. So that's good to know. Pregnancy, well, melasma, what we call cloasma or pregnancy mask. We see a lot of cases, develop pigmentation or irregularity of pigmentation during pregnancy stages. Some people, I'd say probably 50% of people will just come back to normal within 6 months, just by the time the hormonal system just rebalance. But some others are unfortunately left with melasma, epidermal melasma. Chemotherapy and radiotherapy, that's another reasons why we may develop hyperpigmentation. The same thing with drugs or antibiotic. A certain medication will trigger the hyperpigmentation. Laser procedures, certain lasers, not with the right phototype or not with the right nanometers of wavelength, may, on certain case, not all of course, if you're, have that Fitzpatrick skin type 3 or 4, you may, or darker skin, you may have more predominantly or be predisposed to hyperpigmentation. And it's an interesting thing that we relate vitamin B12, a lack of vitamin B12. So let's say you got rid of your pigmentation, you receive a treatment, product or treatment, and you're so happy everything is gone, and then a few months later it comes back. It's new pigmentation. Well, we found out with our research, as you know, we do constant research. We work with several universities around the world, and we work with researchers, and we have an amazing R&D team. And what we found is that the B12 is not well absorbed throughout the colon. So if you all read my book, The Green Square, right, and basically the yellow rectangulars, so the bilious and the nervous body type, they're the ones that have more a problem with irritable bowel syndromes. And there's a direct link of malabsorption through your colon of the B12. So of course, in order to have a good absorption of B12, you need the other B complex and mineral. So it's an interesting, thing to look at. Of course, topical product that may cause photosensitivity or phototoxicity. And in other words, it could be essential oils with, maybe some laboratories or some cosmetic product companies don't know about formulation. And if they may formulate a product that will cause hyperpigmentation with the exposure or light exposure. I appreciate it if you don't mind putting your microphone on mute during the presentation. Thank you so much. And I will give a period of time for questions at the end. So of course, melasma or cloasma appears on the face. We see a lot more when we do have a hormonal imbalance, but I will explain a little bit how that takes place. But the etiological factor, which we call hypermelanosis, is really caused by sun exposure, pregnancy. We said, hormonal influence. The genes, of course, mother or father have hyperpigmentation or are predisposed to it. More likely, we have a chance to develop hyperpigmentation at 50%. The endocrinological problems are, of course, due to a hormonal influence. If you see unwanted facial hair, those are a sign, or hair around the nipple area, that could also be a sign that you have some, certain blood markers that needs to be evaluated, and you need to have a blood test and see an endocrinologist in those, severe cases. So of course, the aridity, the development takes place. We talked about that. That's genes, metabolic disorder, endocrine disorders, inflammatory disorders, chemically induced disorders, nutritional disorders, and of course, neoplastic disorders. All of this we see in different cases. So there's many reasons why we can develop those brown marks or pigmentation. What we see the most though, for example, when you take cases of tetracycline, there is some cases that are genetically predisposed to hyperpigmentation that will develop that hyperpigmentation. Lack of vitamin B12 and also some chemotherapy for chemotherapy agents may also stimulate hyperpigmentation in our study. So there's a lot of relation or correlation with aging and hyperpigmentation. So of course, we've explained earlier that the dendrites, I call it dendrites, really, the melanocyte cell, the dendrites, so the octopus, when it gets really dry due to a lack of estrogen, may also contribute directly, to the hyperpigmentation. But let's keep in mind that one of the main factors would be hormones and of course the sun. So cloasma, let's look a little bit about melasma. I mean, of course, I don't know if you realize, but melasma, first of all, how do we identify different types of melasma? So we use a woods lamp. You probably have seen a woods lamp like this one. It's a UV light. It exists in different forms. But if you look under the UV light, a melasma that's epidermal becomes darker. It means you have a pigment, you go under the woods lamp or the UV light, and it becomes darker. Well, that's a good sign because that means you have epidermal melasma. And when you have epidermal melasma, a good sign because it's easy to treat. But when you go, you have a pigment and you go under the Woods lamp and you actually have the color with no changes. I mean, it doesn't amplify, then that is dermal melasma. So it's a simple way to identify, if it's an epidermal or dermal melasma. So you can see here in this case, we have, under the regular view, when we go, of course, it's amplified. We have a combination of dermal and epidermal melasma. You can see here as well, so you see the pigment under the UV light, you see those pigment are really darkened. Those are epidermal melasma. So it's just a, like here, you can see very well the pigmentation has been amplified. So there is digital imaging when you go see your professional, they'll take your picture, so you really can see, how the skin improves. And with good skincare products, you can actually see results. Within usually within a month, 30 days, 21 to 28 days, you can see a big difference. Otherwise, it's slowly. Of course, the first day you start seeing, 10 days after, a lot more. But it's important to document so you can see the improvement, and it's really motivating when you see the results. Of course, the Woods lamp also relates to the, if you can look at the orange dots that we see, it's amplified. It's basically what we call the porphyrin. So there's a new study, a recent study, I should say, that demonstrated that pollution and porphyrin, the combination of both, may contribute to hyperpigmentation. So I generalize and say that the microbiomes, which is all the little bugs that lives on our skin, needs to be in good symbiosis with the pathogenic one and the regular ones. And if we have a good symbiosis, then we have a healthy skin, and we shouldn't have those occurrent hyperpigmentation spots. So this is why it's important that if you do see under the Woods lamp or UV light or at your examination, if you see those orange dots, to make sure that you do treatment, to use products like cleansers that are bacteriostatic, so that those porphyrin, which is a debris released from one bacteria that's pathogenic that cause pimples or vulgaris acne, actually does not occur. It shouldn't be like this. It should, that's really too much. So if you have hyperpigmentation, maybe that is one of the cause. So these are new studies that are occurring. And of course, the Woods lamp helps us to define, for example, herpes simplex 1 in this case, of course, telangiectasia, etc. But our concern is about hyperpigmentation. So we really want to take a good look and see the depth of the pigment and see how fast we can have a good result. So the facts are, in pregnancy, just due to hormonal changes, that 50 to 70% of pregnant women develop melasma. Like I said, it may go after 6 months or before, but sometimes there are reoccurrent and they stay there. So we need treatment after 6 months. 8 to 29% women that are taking contraceptives. So those are statistics that exist. So suddenly the pigmentation or the spots occur because I took a contraceptive. So you need to discuss the changes maybe with your doctor. And melasma, there's 4 different clinical patterns, but what we're interested in is more, the central facial. So it's really located in this particular area, on the upper area of the cheeks. You can see the melasma is symmetrical. So you can see that on the upper lip, especially when you have pregnancy, we see that taking place. And I want to take your attention that if you do some bleaching, which we shouldn't do bleaching on the upper lip, maybe there's a there's hair that you want unwanted and you want it to be a little bit lighter. So the people that use bleach, which shouldn't be used over there, it's very important that that day that they use it, they don't go in the sun. Why? Because it may cause phototoxicity. Therefore, you may have a pigment that is left just because of that. So you want to make sure you use a sunscreen if ever you do these types of treatments. The same thing with waxing. The resin of the wax, if it remain under the skin, it may causes hyperpigmentation. So we want to make sure we're clear, use a tea tree oil post-waxing to make sure that there's none of the residues of the wax, especially if you're going to go outside, just as a small comment. Now in post-inflammatory hyperpigmentation, remember earlier I said, okay, let's say you have acne, you have an inflammation. In this case, the sebaceous gland is really hypertrophic. That means it's larger. And if it's larger, what happens is that that oil actually has some compression against the basal germinative layers, and therefore that's where your melanocytes are located, and you may have a disturbance as far as the pigmentation, and that's how we develop hyperpigmentation. Again, it could go upwards, the pigmentation, when it's well distributed, but also downwards. So we find pigmentation in the dermis tissue, but when we have post-inflammatory hyperpigmentation, we find it in the dermis tissue. So it's a little bit more complicated. In hyperpigmentation in acne, you can see those acne scars, the pigmentation. The same thing may occur with eczema. So that is important to always remember, that healthy skin is the #1 mission, so that we could be, always protected and none of the disorders appear. Acne blemishes occurring, you can see that you have breakout, but that person may have pick on their skin. And the more you pick, if they're a Fitzpatrick skin type 3, 4, they are prone to pigmentation. So I'm a darker skin, here I am, I have post-inflammatory hyperpigmentation. I have this pigment caused by these acne scars. So I think it's important that we know this. I'm not going to go into the detail of poikiloderma. I don't know if you're familiar. I may have a picture, but that usually happens at hormonal time, or hormonal unbalanced time around the menopause or perimenopause period, where your neck becomes really red and pigmented. So you see pigment, and that's called poikiloderma. So that's actually located in the dermis tissue. So it's a different treatment for these particular type of pigments. The other type 2 that I want to discuss is that, in the capillary, if you're a person that flush and turn red easily, or if you're extremely sensitive overall, well, we know that because the capillary are more permeable, if they're more permeable, that means the blood part, the hema, the pigmented part of the blood, gets through the skin and may cause a polymerization in the skin. What that means is that it causes a brown mark that is not caused by the melanocyte, but that's caused rather the pigmented portion of your hemoglobin. So it's an interesting also aspect to know that, yes, that could occur. And all Fitzpatrick skin type can have that type of post-inflammatory hyperpigmentation. So it's a different treatment. We can see, of course, the age spots. We can see that there's a combination of lack of minerals or oxidized minerals that are staying within the skin.
Right, madam.
Well, thank you for putting your microphone on mute. And now we're going to look at perfume. Now look at this. Perfume, I mean, if you don't know the brand you're buying, and if it's not the laboratory that cares about skin and skin anatomy and physiology, then you may have an issue, because the perfume, there are some of the ingredients, essential oils, that causes that phototoxicity. It does happen also when you buy, for example, deodorant or body lotion. You put it on and you go outside in the sun and you lie in your, in your garden, and then suddenly you have that phototoxicity, we call it. It's like a photosensitivity of the sun. And it takes literally a picture of where you actually applied the perfume, for example, in this case. So you have to be extremely cautious about the laboratory you work with, the skincare company you work with, because that, we need to know what we're putting in the ingredients as far as body creams, lotions, any forms of topicals, or even deodorant, so that we don't provide you with a product that will cause phototoxicity like this. So I think it's important to know. Ochronosis is often caused by hydroquinone. I'm not going to talk too much about hydroquinone. Certain country has already banned this chemical. I mean, it's very effective against bleaching the skin, very effective, but unfortunately it does cause cell toxicity on long run or long-term application. So we try to stay more on the nature side, to go gradually, to treat the melanogenesis process through the tyrosinase, but less aggressively. So less aggressive, I mean. So just for that purpose, you need to know that, yes, it may happen that you see a ochronosis taking place due to those chemical agent induced. Certain, long-term application of kojic acid. In Europe, it's been banned. So many countries do not accept those chemicals anymore because of the abuse, and people, unfortunately, don't necessarily use it the right way. So let's keep in mind that people that are more predisposed to hyperpigmentation or melasma are the Fitzpatrick skin type 3 and 4. So those are the ones that, when we look at the sunburn pattern, they don't sunburn so easily or never, basically. They never have a sunburn. Then as far as tan, they usually tan, or once in a while they tan. They don't usually burn, they just tan. Or they're always tan whenever they go into sun exposure. So this particular skin color or skin type are predisposed to hyperpigmentation and melasma. Now, when we talk about molds or hyperpigmentation, we just want to make sure that there's none of what we call the ABCDE of skin cancer. So those are things you should be aware. So A is really for the asymmetry. So if it's asymmetry, like this one, it's symmetrical, this is good, it's round, it's perfect. When it's not asymmetric, when it's asymmetric, sorry, you do see that it's not in a round shape, then you should maybe pay attention and consult. The same thing with borders. This one doesn't have borders, this one has little borders. See multiple color, you can see there's multiple color, and larger than a 2 millimeter, like an eraser of a pencil, sorry. If you look at the pencil size, if it's larger than this and it has all of the ABCD, then you should be really concerned and consult regularly with your dermatologist. So you see if there's also change, it evolves. So we say A for asymmetry, border, color, diameter, and E for evolving. So from this to this, you should be concerned, even if it's lower than 2 millimeter circumference. So we just need to be paying attention for those mold changes, just so that we're not, we're really paying attention and taking preventative measures. So the consultation is important. Clinical consultation is key because with your physician, with your skin specialist, you will be taking time and discuss, of course, the genes, outdoor activity. If you're going to be always outdoor, you need to wear sunscreen on a regular basis and reapply. And of course, mineral component that has UVA and UVB protection. We also know that stress may contribute to hyperpigmentation, believe it or not. More you have the stress, more you have the constriction. More you have the constriction, you don't have the cellular metabolism taking place regularly. So you may have, unfortunately, some abnormality. So we need to control stress. Maybe yoga, meditation, relaxing, breathing, taking the time, or a good Nelly the Vuyst bath. It's like a session of yoga if you don't want to do a yoga session. It's a little bit more expensive just doing your yoga, but just take the time for yourself because we know that that could be directly correlated. Of course, we talked about medication, birth control, and certain drug treatments, medication may contribute, to the pigmentation. Now, you all read my book, I hope, called Anti-Aging Your Body Type. So basically, it's all about the 4 body characteristic of 4 body type. And I don't want to talk too much about this today, but why do I refer to body type and hyperpigmentation? Basically, is that if you're part of the lower part here, that if you have a muscle structure that is medium and your bone structure is medium, your feet and hands are always cold, you don't have a tendency to gain weight that much, then you're more likely to fit within these 2 types. And if you do, you are predisposed, first of all, to hyperpigmentation. That is your genetic predisposition. You usually have irritable bowel syndrome. Your parasympathetic nervous system is sometimes out of control. So we know that if you have hyperpigmentation, it's due to the melanogenesis process. And in other words, it's caused by the melanocytes. That it's really the MSH hormone has been stimulated due to the nervous system. So we need to calm you down, relax. If you're part of the upper part, the ones that are always hot, the muscle and the bone system is larger. The muscular system is more round. If you're in this body characteristic, you have a tendency to gain weight easily. You always have to be on a diet if you're in this case, because you have obesity, you have a tendency to. Otherwise, this one, you always have to be on a diet. You flush and blush easily, you turn red easily. Your muscles are really round and full. So if you're in that category and you develop hyperpigmentation, it is usually related to the pigmented part of your hemoglobin. Because your capillary are more permeable, you're more likely to develop that type of post-inflammatory hyperpigmentation. So we would treat the skin differently. We would work more on the circulatory system rather than work on the pigmentation, work on the melanocytes. Of course, there's devices that we use in studies and some clinics to evaluate your skin, and of course to see that you're always on the right track. So in this case, you know, for wrinkles, she's on the right track compared to female or male of the same age group. And in the cases of texture, she's good, she's in the green zone. We want that. The telangiectasia, if you have telangiectasia and you have hyperpigmentation, more likely it is caused by, it's more like a post-inflammatory hyperpigmentation. So we need to look at the the pigment part of the hemoglobin, rather than just look at the melanocyte, as I explained earlier. If you have UV damage, of course, you know, it would appear, like in this case, you could see she has a darkening of the pigment. We can see it better here where the melanin content has there's a higher count. So she will be predisposed to melasma. So if she gets pregnant, she will get a predisposition of melasma. So we can prevent that to happen by good exfoliation, you know, taking good care of your skin. That will not happen. So she should be in the green zone, not in the red zone, in the, you know, too much melanin content. Pores, the same thing. The microbiota, remember we talked about, we want to have a healthy microbiota. Porphyrin, we want to make sure to avoid that because we don't know if there's a direct link of hyperpigmentation and porphyrin. That means that bacteria that is maybe in a higher count that's pathogenic, that may be affecting your skin. Of course, spots, the same thing. And in this case, she has a lot of spots because it's caused by the higher content of melanin. And then, you know, you monitor and you see the improvement. So of course, the home care has to be simple. So with Nelly the Vuyst, we have a very simple regimen. When you are hyperpigmented and you have hyperpigmentation and you also have dryness, then you want to use a cleansing milk versus a foaming cleanser. So all cleansing milk in Nelly the Vuyst would be appropriate. But especially we recommend the cellular matrix. It's based on DNA from sperm of salmon. It's very hydrating. Then we would have the lifting pH toner. Any of the Nelly the Vuyst pH toners would work because they rebalance the pH of your skin. We want to bring it back to a healthy pH of 5.5. And then the 3-minute gommage. So those clients that don't have, or you that don't have a skin that blush or flush easily, this is ideal, the 3-minute gommage. You can do it on the spot every day, or you can do it once a week, twice a week, over the entire face. It's going to bring back a glow. It removes the fatigue and it removes the dead cells that are, you know, really building up. And more importantly, it stimulates the renewal of the cells. So remember the cycle from the basal germinative layers up to the keratinocytes and corneocytes. Corneocytes and keratinocytes. We want that movement ongoing to keep our melanogenesis process system, if you'd like, or activity healthy. So that is important. So exfoliation is key, but not with just any exfoliant. If you're red, then you want to use the exfoliant specifically made for sensitive skin that is for red skin. So called exfoliant sensitive skin. And then to brighten, to moisturize and regulate the tyrosinase, which is the enzyme that actually produces the pigment, we use a product called Radiance Cream. So not only it's going to give you radiance, and it's progressively going to work at the pigmentation to regulate the melanogenesis process. So it's simple and very effective. Of course, I want to repeat that it's not like you're going to use a hydroquinone and bleach your skin. We're doing it in a healthy way, step by step, to regulate the evenness of the skin. One of the main product that we use in treatment is called Oxypeel. The Oxypeel is for professional use only. You need to go see your skin specialist to be able to have this type of treatment. I know at the period of confinement, we're looking at making it available through your facility. So you maybe want to require or at least write to the clinic that you're working with to see if that is possible. So the Oxypeel treatment is quite unique. It's using oxalic acid, and the oxalic acid will really depigmentate the skin. What important thing is necessary if you're using at home, if your skin specialist allows you to use it at home, you need to use sunscreen. So if ideally you use it at night, and then in the morning you want to make sure while you're under this treatment, you're using an SPF 30, that's UVA and UVB protection. And this is the type of treatment results you can get after 28 to 50, in this case 56 days, we really even out the skin. So again, the 3-minute gommage is key to the treatment for your success. We need to get rid of the excess of dead cells that are sitting at the surface of the skin. So we're really using methods, or a method, a vehicle, if you'd like, to get into the skin to make a difference. Oxalic acid that we talked about earlier, and the radiance cream that rebalance, that's your moisturizer for a period of time until everything gets balanced as far as the pigmentation. If there's one thing you need to remember in this whole session, is the sunscreen. Sunscreen is key. Using a UVA, it has to say on the container UVA and UVB protection, not because, as you know, SPF only measures UVB filter. So we need to be protected against UVA and UVB because we know that UVA, if not more damaging. So SPF 30, that also has an anti-aging properties. In this case, we have Acamelia oleacea, which is plant that stimulates more collagen into your skin, because as we age, unfortunately, we don't produce as much through the fibroblast activity. We want to make sure, of course, we're protected. SPF 30, have a very good spectrum, especially when it's a mineral sunscreen. And of course, we want to protect you against digital blue light. So because you can use a product, or you're genetically predisposed, and just walk outside, just the light may cause that pigmentation. So we want to use regularly SPF 30 on a daily basis, and especially if you're going to be going outside. Digital, of course, anti-pollution as well. We're proud to say that the SPF 30 from Nelly Vuyst is new. It's a translucent formulation. It's actually certified by EcoCert Cosmos Organic, which is the largest organization for organic formulation and cosmetic in the world. So we're very proud to have this type of formulation. It's reef protection. So you can actually feel safe when you actually go in the ocean. Certain states like Hawaii or even Mexico has banned any chemical SPF, which is 95% of sunscreen markets today. So we need to make those changes for our environment and work with sustainable product. And for that, you need to work with a mineral sunscreen. So protect the environment and protect yourself, especially if you're predisposed to a hyperpigmentation. And by the way, it's the same thing for lakes. We talk of the oceans and looking at the corals not to have the bleaching with those chemicals that exist in all SPF that are, we find usually in the markets. It has to say mineral filters, UVA and UVB, and protect I was saying the environment as well as the lakes. So there are different types of treatments. I would need a week with you to go into details of the hyperpigmentation. I tried to summarize, but there are chemical peels that are in treatments, like alpha hydroxy acid peels that you can receive with lactic acid, different forms of mandelic acid that are used in facilities and professional centers to bleach the skin progressively. There's different types. I would like different types of treatments and lasers, like Q-switch lasers, microdermabrasion, etc. I'd like to focus a little bit more on IPL. So as far as the cosmeceutical ingredients, I mentioned we're using oxalic acid. So, it's important that you know the source of your ingredients, or at least the laboratory you work with. So, because where is it extracted from? What is the method of extraction? What's the part of the plant and what's the percentage will all count in the results. The more important is what is the method of delivery. What are we looking for delivery system? Because, you can have an ingredient, say, oh, that's good, there's licorice. It's good, it has a good depigmentating agent. Where is that licorice extracted from? What time of the year? What part of the plant? It doesn't say on the label. That's part of laboratory formulation. The same thing with vitamin C. When it's delivered, 100% delivered on your skin, it's not an ascorbic type. So sometimes you look, it's vitamin C, it's good. Well, maybe if it's an ascorbic type, it's actually oxidizing your product and already promoting ROS, reactive oxygen species. So reality, you think you're buying an anti-aging product or a product that will kind of lighten your skin, but it actually ages your skin prematurely because the product, especially ascorbic acid, it's not a product that is stable. So it's very difficult to work with. That's why you need to work with different forms that will not oxidize in time so that you can know that in your product it's always safe. So it's important to know all these details. Again, working with a delivery method, we work with the diadermic methodology, so we're really able to work within the skin. So you can get some results, right? So there's different devices. I'm going to focus with the IPL 360 in this case. You can see the pigmentation. You can see how much we can get as far as results. Between 1 to 3 treatments, you can get this kind of results with an IPL, intense pulse light technology, with the right energy delivery per centimeter square, and of course the right technology. So this is the type of results. Sometimes when you want to go faster, you know, you have a photo age skin, you need that little push and go see your clinics to get this type of results fast, and then you have to maintain it afterwards. So those are the types of results you can achieve. And of course, even for redness, you know, within 1 to 3 treatments, it's gone, the telangiectasias. You can see that those capillaries dilated or completely restore. And then you want to balance so that you don't have in time even hyperpigmentation as you're aging. Most likely it'll be rosacea as you age, but at least we can prevent. And there's a capsules, you know, more information if you'd like on rosacea in another topic. But photo age skin can definitely look so much younger and so much better when you actually get these type of treatments. Lentigens, I'm sorry, you can see that there's a lot more improvement, of course, in collagen reformulating, stimulating more collagen, plumping up the skin will make a difference. So, of course, overall, we need to remember a few points. We need to drink a lot of water, like at least 1.5 liters per day, because if our skin is dry, the dendrites at the end will also be affected. If your overall hormonal system is not balanced, then your dendrites, which your melanocytes octopus, will not deliver the pigment properly. So we need to make sure that we use SPF 30 on a regular basis, UVA and UVB protection. The sun protection, every time you swim, you should reapply sun protection. When you have a mineral-based sunscreen, it's actually protecting you until you wash it off with a cleanser that actually foams. So unless you use it, you go to the beach, you want to make sure you reapply your sunscreen. Of course, manage your stress. Well, that's going to be difficult at this time, but try the best you can. If you know you're overstressed, just try to relax. And of course, vitamin B12 with other minerals combined with other vitamin B to make sure that they're absorbed by your metabolism, by your colon. It's going to make a big difference in preventing, because people get a treatment and they say, why is it coming back? It's not coming back, it's new pigmentation. But reality is they don't realize that, you know, sometimes it could be related to food. So you have to pay attention to everything. All right, so aging, I will need another session, and we will have another session with photoaging. What you need to remember, of course, as we age, in most cases, we have a thinner epidermis and, of course, a thinner dermis tissue. Some cases we'll have a thicker epidermis, and no matter what, we will have a thinner dermis. So we have less vascularization, we have less protein, or actually fibroblast activity that produces this cell that produces your elastin and your collagen is reduced. As a matter of fact, around the age of 25, it's declining. So unfortunately, it's affecting your aging. And of course, if everything is declining, not working in symbiosis with your microbiota, then you may develop hyperpigmentation. Melanocytes may occur. Of course, hyperactivity of the melanocytes may occur. And the sweat glands and the sebaceous gland may be reduced, especially if you're 51 years old, perimenopause or menopause or postmenopause. If you're dry because of a lack of estrogen, you may feel that you have less oil on the surface of your skin. So your hydrolipidic factor, what's there, your skin needs that moisture from the sweat gland and from the sebaceous gland in order to protect us well. So that is also altered. That's why it's important to keep everything in place. Now, the aging factors that we have the intrinsic aging. That means it's basically your genes. Your mother and father gave us that gene, and that's what we have to live with, obviously. With that, unfortunately, hormones decline as we age, and we do develop some specific skin pathology. We always like to refer as a twin. You know, why is this twin, which is born at the same time, aging not as nice as this one? Like, why is it that we're developing more wrinkles, more pigmentation compared to this one? I mean, they're twins. Why do we have this happening? Well, because of the extrinsic. So we have an intrinsic, I'm sorry, my pronunciation from French to English, intrinsic aging, so that's your genes, and then extrinsic aging. That's the UV exposure, of course, the tobacco. I mean, if you smoke or you're secondhand smoker, you have super stress, etc. So all of this will be affected. We said the smoking, pollution, you know, if you work and live in an environment that's very polluted, you will be affected by those ROS. You know, if you have inflammation due to food or your metabolism is very slow, of course, the UV light we discussed, all of this will affect, and that's why, you know, we basically age differently. So we can make a difference, and we need to, you know, to start making those changes so that we can see that difference. And we are the one that's responsible for all of this. Maybe not our genes, but definitely the rest. So we can make a difference at the mitochondrial level. So the telomere, I mean, of course, they're shrinking, they're shortening. So aging takes place. And of course, our estrogen declines, our progesterone, testosterone, everything, melatonin declines. We need to make a difference. We need to make some changes, because as we age, unfortunately, they are affecting our skin, and our skin is there to protect us. So our immunity is not the same. So we need to make those change. Exercise, you know, nutrition, etc. Our mitochondrial cells, our DNA from the mitochondrial cells are affected from all these factors, those stressors. Oxidative stress test, not test, but oxidative stress. You know, so many stressors, as we discussed, as well as alcohol, can cause a lot of unfortunate glycation, you know, aging. So we need to take those measures. And if we keep in mind just the sun, protect ourselves, and don't forget about the vitamin D, because, you know, face is where we develop a lot more hyperpigmentation on our arms. So we want to have certain exposure and certain times to develop vitamin D for 20 minutes per day. The rest of the time, we need to make sure that we're having a good sunscreen. And this is an example of someone that's exposed to the sun from one side, so age wrongly from one side to compared to the other. So again, that's the sun and the environment. You know, we say that the stress can cause, you know, unbalance overall, and not affect our immunity or affect our skin, or affect different changes. So vitamin loss, so of course malabsorption, I'd like to say, or vitamins that are not well absorbed. Mitochondrial fatigue, so we don't have that much energy, and of course adrenal fatigue. All of this may contribute to hyperpigmentation. Glycation, I mean, if we don't have the right heating habit, we know, let's stay focused on vegetables, you know, vegetables that are colored. So, I mean, not too much beta carotene, because if you're predisposed, if you're a Fitzpatrick skin type 3 and 4 and you eat carrots all the time, it may affect your pigmentation. But if we take it, you know, in a healthy manner, vegetables and fruit, as many as you can per day, and forget anything that's sugar or yeast that, or you know, cheese that are fatty, or you know, canned food and you know, fried food, that will make a big difference in our aging process. So for our anti-aging in Nelly the Vuyst, we have two lines, the cellular matrix line, and that's very popular. It's based on DNA from sperm of salmon. Nelly the Vuyst was the first one to work 50 plus years ago with DNA of sperm of salmon. Then a lifting complex, pH toner, we exfoliate. We use a serum called firming serum. We also have peptide serum that is new, was launched in December. So the peptide serum is 3 different peptides that really stimulate new collagen in your skin. So it's very popular, as well as a melatonin oil. That's actually an oil called radiance oil that brightens the skin and rebalances the melatonin within your skin. And then of course the lifting complex cream. So it again has all forms of peptides. Cellular matrix cream as well, regenerates the skin and really keep it in good balance. That is it for today. So of course, Nelly the Vuyst as a sponsored, as you are all well aware, Nelly the Vuyst, we're proud to have 11 products that are organic certified in anti-aging called the Biotens. We had a lot of the media exposure in the last year and put us at a complete different position. Results with certified organic by EcoCert has not been existing, so we're so proud to have that. The same case with anti-acne. So the claim anti-acne is a government controlled claim. When we say anti-acne is a medication, so therefore we have to prove that it has an efficacy. So we're proud to say that we have 6 products for anti-acne that is now prescribed by dermatologists, specifically with the organic certified line in the biomedical. So it's anti-acne called the bioacne line. And then we have women's wellness. I will have a presentation like this on everything you need to know about microbiota of the vaginal flora. So there's 10 products specifically for women, for women's health. And we want to make sure that our pH is always at pH 3.8 to 4.1. And if your pH is always within that zone, then you're healthy and you don't need any products. So we will talk about that in the next capsule, but we're proud to say that we have those 10 products. And then in bioscience, bioscience is a full line, the original line in Nelly Vuyst, all related to different types of anti-aging products and rosacea products. And you can see a little bit more on nellydevuyst.com of all the different magazine exposure that we've got. If you didn't have a chance to look at YouTube, please take a moment. Go under YouTube, go on Google, type YouTube, and on YouTube channel, please type in Nelly Vuyst. And then go, for example, click in on Nelly Vuyst bioacne or biofam, go on any of the codes, and you can actually have more details of the science behind each and every product. So I think it's very nice, very well done. And if you want to have more information on other skin condition, we have other capsules as well. Please reserve your skin consultation at the clinic where you're actually going at your skin at your skin specialist. It's important to reserve. We do Zoom, we do presentation like this where it's a private room for your personal consultation, and you can ask your spa, your medical spa, about your next session. And of course, look out at our promotions, different promotions that are presently ongoing. And right now we have the facial in the box. So you can actually do your facial directly from home during this COVID-19 time and have your step-by-step protocol for your skin treatments. So we make it available for you. I appreciate very much your time today. Nelly Vuyst is the sponsor, but Derme & Co is the company behind Nelly Vuyst, and we're proud to say that we are now producing, not now, but we've been producing disinfectant. So if you don't know about the Alaska brand, you should be looking into it. So we're proud to be behind the Alaska brand as well. So I thank you so much for your time. And if you have any questions, please email us the questions or just write. You have a place on the Zoom so I could answer any of your questions. I thank you so much, and I'll see you at our next time. Thank you.